Good evening and welcome. I'm Chris Parnell.
Reporting from Moscow.
Tbilisi, Times Square.
May your dreams be your only boundaries in life.
Hello and welcome to Living Well. I'm William Kinley. The flu season can begin as early as October and run all the way to May. Dr. Cassandra Howard, Medical Director for the Emergency Department at Methodist Le Bonheur Germantown Hospital, joins us today to talk about what we need to know to protect ourselves from this virus. Dr. Howard, welcome to Living Well.
Hi, thanks for having me.
Well, let's just start at the beginning. How do we know, do we have the flu or do we have a cold?
Right, so similar symptoms for both. So most folks with a cold will assume they have the flu, but the cold in general tends to be milder. They share similar symptoms, but the flu tends to be more serious. You're sicker, higher fever, severe body aches, bad cough, and the flu, unlike common colds, can progress to more serious illnesses such as pneumonia, bacterial infections requiring hospitalization and even death. And
are they both virus caused?
They're both caused by viruses, but different viruses.
Okay.
Common cold, rhinovirus, but the flu is caused by influenza, influenza virus.
So we plan every year for flu shots, and we hope that the antigens will be the right ones.
Correct.
And so we get a flu shot and we'll be protected from the flu. When's the best time to get that flu shot?
As soon as possible. So different manufacturers produce the vaccine and ship it around the United States, but most of the time it's available by October. So we'd like you to get it as early as possible.
Okay, so just go on and get that done. Is there a time period that it lasts through?
Yes, the flu season tends to, like you said, extend through May, and if you get it vaccinated in October, you will be protected through the end of flu season, which is in May.
So who should get the flu shot?
Anyone eligible for it. We recommend the entire community if you can, but the flu shot is approved for children 6 months of age and older.
Okay.
So if you don't have a contraindication to doing so, we'd like you to get the flu shot to protect yourself and prevent spread throughout the community.
Are there folks that shouldn't get the shot?
Definitely. If you've had a severe allergic reaction to the flu vaccine in the past, severe allergy to eggs, you're not a candidate. There is a neurologic disorder called a Guillain-Barré, GBS. Those folks are not candidates.
Okay, okay. Well, if you get the shot now, as you were saying, you'd be protected on in through January and even into May. Is there any protection that carries over from year to year?
No, unfortunately, the strains of the flu that circulate around the globe vary from year to year, and scientists, they look forward around the globe and try to pick the 3 most common strains that may hit our area. So each vaccine from year to year is different, so you should get an annual flu vaccine.
Okay. Well, one of the things that I bet you've probably heard is, I don't want to get a flu shot because the last time I got one, it gave me the flu.
Exactly, and that is probably the greatest myth during flu season. One cannot, I say again, cannot acquire an influenza infection either from the flu shot or the flu mist, the nasal mist.
Okay, so just not possible.
Not possible. The flu shot is made from a live attenuated or dead virus, and the nasal mist is made from a weakened virus, so it cannot cause flu within the body.
Probably asking you to speculate a little bit, but those folks that claim they got the flu when they took the shot, they probably did feel they were sick the following day.
Right.
Are there some reasons that could be expected if you get the flu shot that you might not feel well the next day?
Definitely, and I think what these people are mistaking, they're mistaking the common side effects for the actual flu infection. So those who get the shot, tenderness, swelling, redness at the site of injection are very common. Body aches, mild fever, low-grade temp are very common. Those who get the nasal spray might get a little congestion, a little runny nose, but those are not indicative of a true influenza illness. It's a side effect.
And they should go away how quickly?
Fairly quickly. I mean, within a week or two, you should be, feeling fine. Most folks will pre-medicate with a little acetaminophen or ibuprofen to kind of attenuate those symptoms, but I think it's a fair trade-off compared to getting the full-blown influenza infection.
Well, sure, and you bring up a good point. I know at Methodist, when we are doing the massive vaccinations that we do for all of our associates and physicians, we have a Tylenol, acetaminophen there. For them. Is that something that you would recommend for the public as well?
I would, yes.
So
definitely.
Just go ahead and take that.
Take it and just roll up that sleeve, get your protection. A couple days of soreness and just feeling a little under the weather are far greater trade-off than actually weeks of severe illness from the flu.
You mentioned the nasal vaccine. It sounds like it's made from a different way, but what are kind of the pros and cons?
It's not approved like the shot, the injection. The injection is good for 6 months and older. The nasal spray is only approved for 2 years to 49 years old. So those younger than 2 and greater than 49 are, shot candidates, if you will. And then there are some folks that may have other caveats or reasons why one might be better than the other, and we definitely recommend they see a healthcare provider to see what's best for them. Both are equally as effective. One's not necessarily preferred over the other.
I see. I see. Well, I know some folks really, if you can avoid a needle,
exactly,
it would be a good thing.
Exactly.
But really not it's not a painful injection.
It's milder. I mean, we've definitely given other vaccines that are definitely more uncomfortable.
Right.
And with the acetaminophen, I think it's tolerable.
That makes sense. What about from a public health standpoint? I know a lot of folks, flu is a big cause of death, particularly in elderly. Have we seen with the really push in our community and across the country to get people vaccinated, have we seen any impact on that?
We have. On the years where we have good education and folks respond, the community responds and gets vaccinated, there's 2 benefits. One, you protect yourself, and number 2, if you're vaccinated and you don't get infected, you've protected your neighbor. Maybe there's someone in your community that for other health reasons cannot be vaccinated. You getting vaccinated will help protect that person. The last 31 flu seasons from 1976 to 2007, according to the CDC's website, there have been as few as 3,000 deaths annually, up to 49,000 deaths annually from the flu.
So that much variation?
That much variation. So
wow.
I think the more people we can vaccinate and immunize, the better.
I think that the point that you make about your other people in the community protecting them as well is a really big deal. Sometimes folks don't put as much emphasis on that. It's important. I know in the healthcare setting it's become a lot more of a focus.
Especially at Methodist, Germantown, Le Bonheur, we take care of the very young. And again, 6 months and younger, those younger than 6 months are not candidates for vaccination. So
you're really looking out for them.
Protect them as well.
Thank you.
Welcome.
It's time for a quick break. Coming up, fall allergies are making life miserable for a lot of Mid-Southerners. The doctor is in with a prescription to make you feel better. We'll be right back.
I see trees of green, red roses too. I see them bloom for me and you, and I think to myself, what a wonderful world. Oh yeah. Okay, Josh, do your stuff.
Okay, people, you know the drill. Canned foods only, guys.
Sometimes you gotta live what you believe, open your arms, cause that's where it starts. Right here with you and with me. What the world needs now is love.
Generosity, pass it on.
A little help from up above. Faith to me.
A message from the Foundation for a Better Life.
GHS-TV has a new website. You can now view any of our shows on our new media pages. Or check out the latest Wake Up Germantown or Red Devil postgame. As always, we're streaming live 24/7. Just visit ghstv.org today.
Welcome back. We're talking with Dr. Cassandra Howard, Medical Director for the Emergency Department at Methodist Le Bonheur Germantown Hospital. Fall allergies affect a lot of us living in the Mid-South. What's in the air right now that's causing us such uncomfortableness?
Ragweed.
Ragweed.
Causing us
It
grief.
sounds awful.
It is.
What is ragweed?
You know, it's an allergen out there. It blooms. It's there in August, as early as August, kind of exists through September and October. And if you're like myself, you know exactly when it hits.
Does it come from grass, from trees, from all the above?
You know, it's here. There are other allergens out there, but ragweed's the most common
And
that's
we're
circulating.
blessed with a lot
and
of
we're
it here
blessed with it.
in the Memphis area.
Definitely.
Great. So that's the ragweed is the major culprit.
Major culprit.
Well, so it could start in August.
Mm-hmm.
When might we think it would be stopping?
Hopefully by October. Normally
Okay,
September.
so it's fairly short.
Short period. And then you
Okay.
move into the molds of the leaves and things like that that are out there if you're sensitive as well.
But not as many folks are sensitive to that as ragweed usually.
Probably not. Yeah, ragweed gets a lot of us.
Yeah. Well, we talked about colds and flu in the previous segment. How do you discern the difference between if you're just having symptoms, some of the symptoms overlap, I understand, that are truly because of an allergy, or you may really have a cold or the flu?
Right. Severity and timing. You know, cold tends to be, you know, viral in origin. Tends to be short-lived, no more than 10 days. If you're unlucky, maybe 14 days, whereas the allergies are going to get you for that entire probably 3-month season. So if you have symptoms that are lingering, not responding to just simple over-the-counter remedies, it might be time to see your doc and you know, see if you're actually suffering from allergies.
And if you have allergies, you're going to need to see your physician, and you mentioned over-the-counter things. What are some things you can do to alleviate the symptoms?
One of the main products in our body or chemicals in our body that cause our allergy symptoms is histamine. So most of us, you know, fleet to our local store to get an antihistamine. Diphenhydramine, Benadryl is the most common. Most don't like it because it makes you a little drowsy, a little sleepy. Other adjuncts that are less sedating would be the Claritins and the Zyrtex and the Allegras out there. Many of those products are over the counter in liquid preparation and in pill form.
Okay.
And so
I know that's one of the, it's a daunting aisle when you go into the to the drug section, and they have daytime, nighttime, all of these things. So how do you know really what we should choose?
Most recommend less is best, especially if you're treating children. You know, you can get something that has one of every symptom in there, but really if you're just, you know, treating runny nose and congestion, try to limit your preparation to that treats, you know, the symptoms that you're having, and then read the label and follow the instructions. You'll be instructed to contact your physician for children 2 and under. There typically isn't dosing recommendations for that age range, but less is best, and avoidance is probably even better, just avoiding your allergen if you know what it is.
That darn ragweed.
Yes. Or mask if you're out raking leaves. Or
avoid the ragweed.
Yes.
Well, are there things in addition to that we can do that'll help? I'm just thinking out loud a bit, but hydration, anything else that we can do physically that help? You mentioned the mask.
Yeah, there's you know, products at home, dust covers for your mattress, for your pillows, you know, barrier protection, you know, using mask if you're out raking leaves, probably not cutting too much more grass this time of year. There are things a little more potent than the over-the-counter medicines that your doc may prescribe. Allergists, you know, they may, their intranasal steroid preparations, things like that, that may give you some long-term relief depending on the severity of your allergies.
So you've tried these things, you're not getting a whole lot of relief. I guess then it's time you need to see your physician. Definitely.
If you're not getting better or your symptoms are worsening, clearly if you're having fevers, severe body aches, things like that, that may be a little more than an allergy. Remember, we're overlapping in flu season as well, and a lot of those symptoms overlap. So, you know, if your symptoms aren't improving, they're not responding to the over-the-counter adjuncts, or you're feeling a lot worse than one would expect with a common cold or allergies, see your doctor.
Nasal sprays. Talk to us about nasal sprays, because I know just in experience they can be quite a relief.
Yes.
I understand they maybe can also be, there's some downsides to them.
Yes, there's always a however comma.
Okay.
Take a spray, you get instant relief, but if you read the very small print on the bottle, most of them will tell you not to use beyond 72 hours. Your Afrins, your Nielsen-Ephrins, things like that. So 72 hours is kind of your pivotal point. Now when we say nasal sprays, not all things are created equal. So there's some prescription products, inhaled nasal steroids that'll help attenuate some of your allergic response, and they work very well, and you would take those longer. So that's where your provider or physician guidance would be helpful.
So what are the dangers in using those nasal sprays longer?
After about 3 days of use, 72 hours, you get a rebound congestion, and I mean your nose just bogs up to where it feels like you can't breathe at all. So kind of a rebound induration or swelling of your mucosa. It's pretty horrible.
And that doesn't go away for?
It'll go away probably within a week to 10 days, but it's pretty horrible.
It doesn't sound good at all.
Not at all.
Oh, that's interesting. I've heard that before, but I never really understand why. So you go see your doctor, and your primary care physician says, well, we do believe it is allergies. Then they'll send you to an allergist.
They can.
And how do we go from there?
I would probably start with your primary care provider. There are a lot of things that the primary care doc can prescribe to help alleviate some of your symptoms. You know, if it's worse than that, the allergist can actually test you to see what your allergy spectrum is.
Okay.
You know, maybe it's not just ragweed. Maybe there's some dietary allergies. Some, you know, dust mites are very common, and folks aren't aware that they're allergic to those. So I think, number one, learning what you're allergic to, knowing what to avoid, can give you more tailored therapy.
So then at that point, in theory at least, if you're having severe symptoms and you can identify the allergen, then you could be getting shots or something so that you could reduce your reaction to that.
Definitely.
That would be great.
Get some relief sooner.
Is there a pretty high percentage of folks that have to go that far to get their relief?
Definitely in Memphis. I think we are the allergy capital of the United States. I think if it blooms and you can react to it, it's probably here. So yes, I think compared to our coastal neighbors, we probably are a little more allergic than some other areas.
Still though, spring, a much busier allergy season than fall, or is that not true?
Tends to be. Yeah.
Okay.
There, more things blooming,
more
pollination.
stuff in the air.
Yeah, if you're sensitive, you'll be a great barometer for what's blooming.
That's encouraging. That's encouraging. So it's one of the positives when it gets cold then.
Yes, definitely.
Good.
If you're not a ragweed sufferer.
Good.
The molds don't get you.
Well, that's great. Well, thank you.
You're welcome.
Fall is here and winter's approaching up next. Some tips you'll need to keep yourself healthy and well in the winter months. Stay with us.
Okay, Josh, do your stuff.
Okay, people, you know the drill. Canned foods only, guys.
Sometimes you gotta live what you believe up in your arms, 'cause that's where it starts. Right here with you and with me. What the world needs now is love.
Generosity. Pass it on.
A little help from up above. Faith to me.
A message from the Foundation for a Better Life.
I see trees of green, red roses too. I see them bloom for me and you. And I think to myself, what a wonderful world. Oh, yeah.
GHS-TV has a new website. You can now view any of our shows on our new media pages. Or check out the latest Wake Up Germantown or Red Devil postgame. As always, we're streaming live 24/7. Just visit GHS-TV.org today.
Welcome back. Dr. Cassandra Howard, Medical Director for the Emergency Department at Methodist Bonner Germantown Hospital, is here with us today. We move on from fall into winter, so we're raking leaves, we're shoveling snow, maybe not, hopefully not a lot of snow, but we're doing more things like that outside. What are some of the health risks that come along with that?
See a lot of falls. A lot of falls in the winter. Wet, damp leaves are slippery. We tend to be more of an ice compared to snow risk in the winter.
Which
so
is
a lot of
worse
falls.
in a lot of ways.
Yes, definitely.
You don't notice it as easily as you should,
Yes,
probably.
Definitely.
So we get icy conditions. Some of us fall down. We bruise our pride,
Right.
as well as other parts of our body. When do we have if someone has a fall? When is it? I probably need to go see the doctor about this.
If you fall, bruise your pride, look around, see who's looking. You get up, you feel okay. If you continue to have pain, fall on your tailbones, pretty sore, a joint, not getting better with just rest, ice elevation, over-the-counter meds, probably a good time to, see your primary care doc and see if you've done a little more damage than anticipated.
Than you think. That makes sense. We're also going to be getting colder temperatures for us here. What are some tips you can provide relative to protecting ourselves from the cold?
First, simple recommendation would be to limit your exposure. Kids out on bus stops, things like that. Go out there, of course, early enough to meet your time. But dressing in layers to protect our skin from the cold. We're not only worried about precipitation, snow, ice, rain, but also just the wind chill itself, damaging the tissue. So cover those areas that are exposed and minimize the amount of time that they're exposed.
Do we maybe here take it for granted a little bit that normally we don't have really excessively really bitter cold like some other areas of the country, but is there kind of a temperature that's a warning for you that, well, it might not be 5 below outside, but it's colder and more dangerous than people think?
Yes, and that varies probably with age. The elderly and the very young are definitely more susceptible, but definitely when our temperatures drop down to freezing, we definitely want to minimize our exposure. If you don't need to be out, don't go out. And if you do have to go out, layering, covering those skin exposed areas, especially those parts more distal from your core, fingers, toes, nose, ears, very susceptible.
Okay. I know hypothermia is one thing that you wanted to tell us more about, but tell me, I guess start with the definition. What's hypothermia? Hypo
means low, thermia is temperature. Your body temperature is lower than normal. 98.6 is a normal temperature. So as your core temperature starts to drop, you're reaching or dipping into the realm of hypothermia that can cause serious
So besides being just feeling cold, what are some symptoms that might alert you that you're trending towards hypothermia?
Maybe not you, but those around you may recognize you're a little more confused, have a little more difficulty concentrating, cool, cold skin.
Okay.
As you dip into it a little further, you can have some changes in your vital signs, slowing of your heart rate, decreased perfusion, and those are the things we don't want you to get to that point before recognizing it. But definitely you're colder, your body temperature's dropping, and the ability to concentrate tends to be compromised.
I guess another risk would be frostbite. Can you talk about that as well?
Yes, frostbite, frozen tissue is basically what it amounts to. There's different degrees, very common in the areas most distal from the core, your fingers, your toes, nose, ears. Again, exposed for too long, and the colder it is, the shorter the exposure that's required. But basically that tissue freezes, and there's damage done to the nerves and the tissue. We want to avoid that as well.
So again, just being smart in what you wear and limiting your exposure.
Definitely.
And we have a lot of folks in this area that are hunters,
yes,
or being out at football games, things that put us at risk. How about so kind of a softball? But if we're out and are there things we drink hot coffee? Does that help us?
Keeping yourself warm in general. Drinking that warm hot chocolate, you feel it kind of warm your core. But remember, if you have fingertips that are exposed, I guess you could wrap it around that warm cup of coffee and heat it up. But remember ears and nose, and just like in the hot months, you can burn well before you realize it. For some folks, depending on what you're doing and how long you're out there, you could actually suffer some tissue damage.
Freeze pretty quickly.
And not know that it's happened. So.
And if we drink alcohol, it makes us feel warmer. Are we warmer?
And not necessarily, and probably less aware of what's happening to you.
So
you're not feeling.
Increases the risk.
Definitely. So definitely avoid it if you're out and exposed. Definitely if you're hunting.
That's good for sure, for sure. How about just as we go into the winter months, it's darker, it's colder. We're not in community as much as we are in the summer months. What are some tips relative to just maintaining a good mental health through the winter?
We tend to hibernate a little more, less social. Get out, get some sunlight. Expose yourself to light. Try to avoid just the dark, cold environment where you're kind of off and isolated to yourself. But light's a good thing. Getting out, family, friends, your church group.
And enjoy the weather. Enjoy the change. We're fortunate to have changes of season and get out. Just don't stay out too long.
Don't stay out too long, yes.
Well, thank you. It's a pleasure having you with us again today.
Thank you.
That wraps up our show for today. I hope that living well will help you and your family lead healthy lives. Thanks for watching. I'll see you next time. I was going to go there.